The most interesting thing is that to make a change in a human being, because these girls were poor and they were in the villages and they cannot afford to go to school. Most of them, they were getting married at the age of 10, 11, 12, and very risky in their lives. But now you need to see them neat, tidy, and they can speak up because they can raise up their voice. They learned about so many things, about negotiation, how to negotiate if they don't like, maybe before they were married out without their consent, but now, believe me, they are raising their voice and negotiating with their parents. I think this safe spaces helped them a lot, and it changed their lives. It changed their lives drastically.
The purpose of our program is to help girls from very poor families in northern Nigeria and in rural areas to transition through each step of their schooling. The way we do it is through safe space clubs. A safe space is 15 to 18 girls, a mentor in a very quiet and protected space. When we first began our program, we spent a lot of time in the communities finding out what the context and what people really wanted and the obstacles to their girls going to school. We very quickly found out that a key obstacle is the very early marriage of people's daughters, of the young girls. 14 is the average, actually 14.9 was the mean, and of the communities we started in, but further rural was down to 14 years old. When we asked parents about a socially viable alternative to early marriage, again and again they said girls' education. When we asked why aren't your girls in school, one woman, the very first woman I spoke to, said, well, I sent my first girl all the way through primary school. She can't read and write, I'm not going to send my others. And it's something we heard again, repeated again and again and again. Why send your daughter to school if they're not even going to learn to read and write? So our safe spaces focus on the first hour is reading and writing, reading and writing, reading and writing. The second hour is life skills like negotiation, reproductive health, and all the different kinds of skills they're going to need through marriage and also through their education.
It is good to know that these girls, the ones that we have started with them for the first 10 years, now they have become cascading mentors. And now we want them to go back to the community and impact what they have learned. And I think with these safe spaces, and Niger will in the future have very good girls that can take care of the country, because if you educate a woman, you're educating a nation. So they can contribute to the development of their society, so that they can have a peaceful society full of education and pride, and we can forge ahead.
One in 10 children born in Togo will die before they turn 5, simply because they have no health care. This is our challenge. To integrate health into every community. Our vision is a world in which everyone, everywhere has access to high-quality health care. We exist to prove that world is possible. We are Integrate Health, a highly efficient, data-driven organization that remains community-led and committed above all else to having the greatest possible impact for our patients. Our mission is to end preventable deaths in forgotten places. We have the track record. We have the dynamic local leadership. We have the impact data, but now we need you. I invite you to join us as we work to integrate health for all.
Hi, my name is Jenny Schechter. I'm the co-founder and executive director of Integrate Health. Over the past 3 years since Integrate Health received our initial grant from Dining for Women to launch a new maternal and child health program, we have more than doubled our service area and the size of the population that we serve. Today, Integrate Health provides life-saving primary healthcare services to more than 80,000 people in Togo. Thanks to Dining for Women's new sustained grant, Integrate Health will be launching an even more ambitious expansion plan to extend healthcare to more than 200,000 people in some of the most remote communities in northern Togo over the next 3 years. Dining for Women has backed us as we have advocated radical notions like the right to health and hiring, recruiting, training, and even paying women to provide professional work as community health workers. Integrate Health has grown a lot since our humble beginnings as a Peace Corps project working in partnership with local activists. Today, your support is helping us to realize our vision to the right to health for all, to realize our vision of ensuring a world where there are not two standards of healthcare, but rather one standard of healthcare, the same standard for everyone, everywhere. That simply would not be possible without our partners like Dining for Women. Thank you for your continued support.